There will also be some more food in 10 minutes, so we ran out, so but there will be some more. Now, without further ado, I want to introduce Mark Martineau. I don't know much about the man, but he seems to have an interesting life, so here we go. Thank you very much.
Thanks a lot, Torsten, and I appreciate the opportunity to come, and thanks to the School of Nursing. The bike run sounds like an excellent idea. I take it it's about the ride and not the prize for the first one that gets there. Okay. That could tell you whether you want to be on the BMW or the Harley. I'm a nurse anesthetist. I work for the Indian Health Service. Right now I'm assigned a different assignment in Afghanistan. I'm just there several times a year. I'll just mention that briefly at the end. This presentation is going to be focused on nurse anesthesia in a historical context, and I'm going to use the slides that I obviously from a previous lecture, and this was designed for the surgeons at the Tuba City Indian Health Center where I worked. I was the chief anesthesia there in the past. And we had some surgeons that came that are used to working in large medical centers. They hadn't hardly even heard of nurse anesthetists, or where they worked with physicians. And we had an all-CRNA group, and some of them had questions whether we were qualified and whether they had increased liability by working with nurse anesthetists. These type of questions come up over and over again. So I think this is also good material to cover for all of us, because as nurses we should have an idea whether we go into nurse anesthesia or not, what the difference is, because that's the question often patients will ask, and depending on who you ask, you may get a different answer. My answer may not be the same as someone else's, for example. But I think doing it in a historical context is kind of fun. This is Mount Rainier in Seattle. I grew up in Seattle. But we're going to talk about the evolution of anesthesia, starting very early, and then a little bit about the origins of nurse anesthesia, great history, proud profession, just like nursing in general. I think we should all feel good about nursing. And then I'm going to go speed through some of the parts that are not as important and maybe a little more boring about the legal parts and CMS, and then answer any questions you have about anesthesia practice today. So anesthesia has a lot of history with dentists, as we'll see, and we think of it more about stopping pain, but it's a lot more than just controlling pain and giving analgesia. It's about making informed medical decisions in the context of surgery and adjusting to the impact of surgery for our patients. Also making medical diagnosis and interventions for the medical conditions that the patient has perioperatively, whether it's pre-existing or if it evolves in the context of surgery. So therefore, there's a wide base of knowledge, and nursing, intensive care nursing, is a great foundation for that. This fellow in the background looks vaguely familiar, speaking of evolution, perhaps a cousin. But I'm not going to talk about that. We're going to talk about the evolution of anesthesia. And I think we should just start really early. We can look at Genesis to start with, and then we're going to just touch real briefly on a few other things that have to do with the history of anesthesia. Most of us have heard this story, and we know that before that part of Adam was removed, he had a deep sleep, and in my book, that's a general anesthetic. When you remove a body part under a deep sleep, that's general anesthesia. Even though this was introduced so early in recorded history of people, it's amazing it took so long for the modern advent of anesthesia. The so-called discovery of anesthesia in the mid-1800s was inhalation anesthesia. Yet we had this for thousands of years, telling us, hey, go to sleep, and yet they were doing surgery all along. There was always surgery, thousands of years of surgery. And the concept of anesthesia has come and went over different times with different cultures during this period. Now, I'm not stating that God was the first nurse anesthetist. I would state that if I was with a group of physician anesthetists or anesthesiologists, so that I could just, goad them a little bit. But I will say that we have evidence that she was probably administered the first anesthetic. So the Egyptians used a combination of opium, and actually the Chinese were the first to use opium in medicine, and hyoscyamus, which is also known as henbane, and that's in the nightshade family, and we use a derivative of that today, scopolamine, still with narcotics. And so this has been in not continuous use, but 4,000 years later, we're still using something similar to the Egyptians. This philosopher, Dioscorides, was also known as a physician and a pharmacist, and he authored De Materia Medica, which was the premier pharmacological text for 1,600 years, and even into the Middle Ages, or not the Dark Ages, but up to the time that we started losing all the knowledge that we had from the Greeks and Romans. And he clearly states in there that mixtures of mandrake and opium were used as sleeping potions for surgical anesthesia. So this really goes back a long ways. These four drugs, henbane I just mentioned is the other name for the one, and mandragora is also mandrake, were common in diverse and ancient cultures in various forms and mixtures throughout the ages, as well as other medications as well. As I said, opium was first used by the Chinese. Herodotus, the famous father of history from the Greeks, wrote about cannabis and said it could, or hashish, and said it could also be smoked as well as eaten. So that's 500 BC. We're talking about inhalation anesthesia in one form anyway. Mandragora was used all the way into the Middle Ages in Elizabethan England, and in fact, Shakespeare mentions it in Othello in 1606, and I quote, "Not poppy nor mandragora nor all the sleepy syrups of the world shall ever medicine thee to that sweet sleep which thou didst yesterday." And so it was still used along with opium in that time. And it has a bifid root that led to the superstition that it was somewhat human in form and that it would shriek when pulled up and could lead to death or other health problems. So they would usually tie a dog to the root, and when he got tired of being there, he would pull hard enough to pull the root out, which required quite a bit of exertion, and then they wouldn't be in an area where it was dangerous. And henbane already mentioned that scopolamine comes from that. And then we know the Incas go back almost 2,000 years, and these shapely skulls were formed from birth with the different, what do you call it, vice type things they put on them to make them more attractive. But they had a lot of injuries injuries in wartime, and we think that, and there's examples of this, that they lived. They even put in plates fashioned out of gold. Trepanine is what this is called, to relieve pressure from probably blunt force in the skull during the battlefield. They also used coca leaves just like they do today. The way they applied this was as a local anesthetic, and they would chew it and spit into the wounds that they were working on. So I don't know what their infection rate was. But anyway, let's talk about modern surgery. Really, the advent of modern surgery is considered to be the 1700s by most people. And men like John Hunter, he was called in one book the father of modern surgery. Well, in the mid-18th century, people didn't understand much about disease or even anatomy, let alone anesthesia. In fact, a lot of the history of the anesthesia that I've talked about was lost. And so when they started operating in these open amphitheaters with the public invited in to watch, it was a barbaric scene of blood and screaming and what I call brutane, where you just hold the patient down. Now, I'm not saying some of them didn't imbibe alcohol, but there really wasn't much thought to anesthesia. And that was probably a factor, along with other things up here, why the success rate was very low. But they were still eager, just like surgeons today, to put somebody under the knife and see what they could do and what they could find. And a part of that curiosity led to a great growth in our understanding of anatomy, because they didn't know, let alone physiology, they didn't even know what parts we had. And this led to a huge black market in body parts. That's where the original term body snatchers comes from, or grave robbers. And that went all through Europe, especially London. There was a time that they said that in London there was not a grave that hadn't been dug up multiple times.